To me, it's all about empathy. It's a matter of sharing the journey with the patient. It's feeling what they feel. And it's about being honest. That's important. You tell the patient how you feel about what's happening in their cancer journey, then they will take your word for it. I remember exactly when I decided to become a doctor. I was 4 years old. I suffered from asthma. And I clearly remember the night that my pediatrician came to my home, gave me some inhalers treatment, and then he left the apartment. And I jumped into the window to look at him and like, "Mommy, who's that guy?" And she said, "He's a physician." And I was like, I want to be like him. My mother, she unfortunately passed away from colon cancer. And I remember one day that she grabbed my head and told me, "Jesus, you gotta be an oncologist." I was like, "Okay, Mom, yes." And that was it. In medical oncology, we treat patients with gastric cancer, colon cancer, rectal cancer. I particularly treat patients with gastrointestinal malignancies. As medical oncologists, we are like the quarterback in a patient's cancer journey. We decide in conjunction with other subspecialists whether the patient needs chemotherapy or treatment, immunotherapy before surgery, or if they need treatment after surgery, or if they need radiation combined with chemotherapy. So we are a multidisciplinary team, and in tumor board setting, we decide what's best for the patient. I'm the happiest oncologist in the world if I see a family member with my patient, because I know that my patient is in full hands. I love when family members come with their patients. I love when the patient's children call me to ask me questions. I fully include the family members in the decision making. One of the big advances in cancer treatment that we're very excited about is the use of immunotherapy. We all have had patients with malignancies that are very big to start with, and you are amazed at how giving immunotherapy to these patients, many of these cancers practically melt away. So at the time of the surgery, you can't find cancer. That has been groundbreaking, and that's very exciting. It feels good to help other people, as simple as that. You go home happy. If you feel that you have helped, that's what it's so gratifying. That it's not a job, it's a calling.